My name is Dr. Manwai Lee, and I'm here to talk to you about Phaco settings for complex cases today. So, how well do you actually know your Phaco machine? I think we do Phaco every day, but do we understand exactly what we're doing? I think most of us haven't read a manual, and then we perhaps look through the manual and understand the actual capabilities of your machine. But some people might not even know what the manual is, or do we have an actual manual? And really it's important because you need to customize your machine settings, and whether we are doing it actually, we don't know. And there is, some people have a standard setting for every case, and that perhaps may not be a bad idea, but really when you move on to the more complex cases, you probably need to actually customize. And a lot of people also leave it to the technicians. You know, the Alcon technicians are very good, and they come in and set up everything for you to start using your machine. So really, the understanding of Phaco dynamics is crucial, especially when you want to become an accomplished Phaco surgeon. And today, what I would like to go through are some of the principles of Phaco dynamics: inflow, outflow, vacuum, ultrasound power, and modulation. A lot of it is quite basic, but really, I think the fundamentals are crucial to understand so that we can use our machines effectively and safely. So understanding the different machine parameters really will help customize settings for us when we actually do complex cases. So what does this all mean? So if you look at the screen here, you know, the Centurion machine that here I'm referring to, the IOP or intraocular pressure in this setting is 50. And what does that actually mean? Now, this refers to the inflow or irrigation, if you call it, whatever amount of fluid that's coming into the eye, and it's the infusion pressure. And in the Centurion, we talk about IOP in millimeters of mercury, but what we could be conventionally used to is the bottle height or centimeters of water. And higher IOP or higher bottle height would equate to a higher infusion pressure. That would make sense. There's more water coming into the eye to inflate the eye and maintain stability. So we move on to what's there highlighted here. This is the vacuum. The vacuum is actually what's removing or the holding power. So the different pumps in the different machines will give you different control of the vacuum. You have Venturi pumps where the vacuum is actually linked with the flow rate, and you have a peristaltic pump system where the vacuum and flow rate are controlled separately. So the linear control is usually with our foot pedal. So as you know, when we operate, the amount of treadle or how we step on the foot pedal will deliver different aspects of the vacuum to us with linear control. The aspiration flow rate here, as highlighted, is 35, but in this case what it refers to is the amount of fluid flowing through the tubing, cc's per minute or milliliters per minute. How quickly stuff comes to the phaco tip is controlled by the aspiration flow rate. And this is governed by the Poiseuille's law, where the equation here, which none of us remember, but essentially it tells us certain parameters such as the radius of the tubing, in this case the R, will actually control the amount of fluid. So how the diameter of your tubing is important, and how quickly things happen within the eye. Now, what are all these other things? So the top right corner is your torsional or ultrasound energy, and on the top left that's the longitudinal. So these are settings, or what we've been familiar with before torsional came about, is really how ultrasound energy is delivered in your phaco handpiece. So ultrasound energy is obviously important, and that's what's emulsifying the nucleus, and we've been very familiar with very efficient use of torsional energy now, but longitudinal in many cases are still useful, and whether that's in the individual surgeon's hands, they like to use an interplay between a longitudinal or torsional is entirely individual preferences. Again, that's linear control of the ultrasound energy. And if you had an Alcon technician with you with a new machine, in this case a Centurion, there will always be suggested settings where they will put things in to try and give you as stable an environment as possible, which is a good starting point. So what are these starting points that we have? If you look at sculpting, a very safe setting is highlighted here. So if you look at the IOP is 50, it equates to about 60 plus centimeters of water. So if you're still used to bottle height, when you move on to the Centurion, you will see that the IOP will have an equivalent centimeters of water reading there, so that you can get acclimatized to this new screen that you're looking at. So 50 IOP, and about 60 vacuum for sculpting. We don't need to hold the nucleus very much. In fact, we don't want to hold the nucleus. You want to move through it as smoothly as possible, and a reasonable flow rate at about 35. When you go to segment removal, so this is when we're going to be doing our chopping, so the vacuum goes up significantly. So this is an example of we go up to 350 or 400 of vacuum. You can go up to higher vacuum settings if you would like a better holding power, but this is a good starting point. And the flow rate will also go up proportionately to about 40. Now the beauty of the Centurion is it's able to have a feedback loop mechanism whereby the IOP can be maintained constant throughout all the procedures to actually give you a stable environment, as opposed to a gravity-based system in the older machines where you have to significantly push up your bottle height in order to maintain stability when you actually increase your vacuum. Cortex removal, so the INA here. So again, the IOP is stable, but your vacuum has gone up significantly, and your flow rate again 35 or 40 to increase how quickly things come to the piece, to your tip. Capsular polishing, not everybody does this, but really what you want to do now is drop the settings really low. So as you see, the vacuum is pretty much non-existent, to zero. You get a lower IOP, you get slower, less infusion pressure, and you dropped the flow rate right down, because what you want to do is just to polish with your IA tip and not really aspirate anything or the capsule. Viscoelastic removal towards the home stretch now. So what we tend to do is to bump everything up again so that we can remove the viscoelastic quickly and efficiently, especially with these dispersive viscoelastics, which can be difficult to come out. So as you see, the vacuum has gone up to its highest in all the different modes, 550 here, and the flow rate has gone up to 45 as well. Now the foot pedal control is again one aspect that I think we don't really pay too much attention to sometimes, but I think it's actually very important, because as you know, when we operate, we are using all our limbs to control and provide the stability and the control that we need. So understanding your foot pedal, it's also important, because if you look at the screen here in your machine, you're able to actually control the treadle or how much you step. You know, everybody has a different weighted foot. Some people are heavier footed, some people are lighter. So you can adjust this so that you can move through the different modes as you actually go from step 1 to step 2 to step 3, and you can control the amount of pressure you have to apply to the foot pedal to move on to the next stage of the surgery. And of course, for myself as well, in the foot pedal, you can actually move from your sculpting to your segment removal IA, and all control with the foot pedal, and that's what I tend to do.